Hey guys, what's up? This is Dr. Craig Banks, and I'm here with my co host, Dr. Jim Morgenstern.
How's it going, guys? Thanks for tuning in.
We're going to be doing episode 7 of Optimal Function today. We're doing a little bit different format than we usually do. Jim and I are not actually in the same spot today because Jim was on vacation, you jerk.
Yep. Yeah.
While I was stuck here sweating like crazy in Ohio. So he was out on vacation. But anyways, we don't have a guest today, so we're going to be doing some Skyping with each other here and still giving you guys some really, really good information. So I know today here was a scorcher, and unfortunately my office did not have air conditioning, so that was not a fun day. So if I look a little sweaty and exhausted, I apologize. Jim had the day off, so lucky him.
Yep.
But
we'll get back into town and get everything organized. So yeah, I appreciate the getaway, but always getting home. It's like a full day of travel and then getting the pups and stuff. So I'm excited to do this, kind of get the mind back in the right place.
Heck yeah. So we have a pretty cool topic today, and it's one that I'll be honest, I mean, until a couple months ago, I didn't even know existed. And it's called Imposter Syndrome. Okay. And a little bit of background on what Imposter Syndrome is essentially it's when a person who is otherwise successful begins to doubt themselves and doubt their own accomplishments, and they kind of view themselves as if they were a fraud. Now we know that these people are not frauds. However, internally, they don't feel that way. They're always thinking that at any given moment, somebody's going to find out that they're not really as good as what they have proclaimed themselves to be, or that people see them as to be. And it's actually extremely common. And I think that it's important that we share this information because unfortunately, again, people just don't know about this. And we wanted to bring it to the forefront because the more you know about this, the more we can kind of put it behind us. And
right.
I know Jim was saying that, he also just recently discovered this as well.
Yeah. So, coming out of school, we've never heard of this, but we learn, in school what to be looking out for when we're taking care of patients, like malingering type issues, or, trying to meet the person, where they're coming in from. So you don't want to meet someone way up here if their energy is all the way down here. And same thing, if someone comes in, they're super, super excited and you're down here, they're going to be like, what's wrong with you? Why aren't you up here? So kind of matching that energy as it comes in. But with this, this is something that I feel can really be a block in the speed or the efficiency of someone recovering from whatever the ailment they're going through. Or if they've hit a mental block in something, it's almost to me like you're your own worst enemy. Craig, I know we were talking about that before we got on air, but I do want you to kind of put it into words that you had said earlier too, because I think that was cool, saying how, would we let someone speak to us a certain way? Why would we let ourselves talk to ourselves that way?
So just a little bit of background, I guess, again, on what imposter syndrome is when it was first described. So going back to 1978, two doctors, Dr. Pauline Clance and Dr. Suzanne Imes, they had described it as the imposter phenomenon, and they were describing it in women predominantly. So these were extremely successful women who, because of certain specific stereotypes at the time, women were not perceived as available to be as successful, or they shouldn't have been as successful. So obviously times have drastically changed, but at that time, many successful women were feeling this sense of self-doubt, and at any given time, they were going to be found out to be this fraud. Now, since then, things have changed. They do call it an imposter syndrome. There is a current expert on the topic. Her name is Dr. Valerie Young, and we'll get into a little bit of the classifications that she talked about with that. But it does not just affect women. It does not just affect men. It affects everybody. And there's just about, I don't want to say everybody, but anybody can be affected by this. How about that? The classification system that Dr. Young put in was kind of cool. And I know, Jim, you saw this out there when you were doing some research, but they talked about 5 different types of people. Number 1, the perfectionist. So in a perfectionist situation, unless you can do something 100% perfect, you feel internally that you're not good enough. and you doubt that. And the next one is something called the natural genius. These are people who maybe like didn't have to study in school or whatever it may be. They pretty much, most things came pretty natural to them. And they feel that if they didn't have, if it just didn't come super easy for them, then they must not be good enough. And they won't take any accomplishments on that. The soloist is another one. The soloist is somebody who expects to be able to do everything without help from anyone else. And again, if they can't do it themselves, then they take that as a form of failure and that they're not good enough. An expert would expect to have every single aspect of a specific topic mastered before they're going to consider themselves successful. And because again, there's just so many things about any given topic, nobody's going to know absolutely everything. They're going to probably have some self-doubt. And then finally, the last classification is called the Superman or Superwoman. And they are judging themselves internally by not just how well they do one thing, but how well they do everything. Not only should I be able to have a successful career, but I should also be able to make sure and have a spotless house and perfectly raised children and a perfect marriage at home. And if I don't have the ability to balance all of those things at once, I'm a failure. So it gets kind of scary because let's face it. I mean, we almost all of us can kind of put ourselves into one of those classifications. So.
Yeah, that is scary, because we strive to, I think in our positions, always take care of everyone that comes through the door. And I know sometimes we're guilty of taking care of ourselves or even putting ourselves on the map to care for. And then, like you mentioned, like, did I take care of this person to the fullest extent, and that times how many people you see in a day can be draining on yourself. And then when you look in the mirror, it's almost like, well, shoot, like I did great today, and you almost have to bring it back to, you do the best you can at that moment in time and move forward. You know what I mean? You can't keep looking in the rearview mirror because it can be draining just as much as each one of those that you broke down, all 5 of those. I can see myself in the mirror and be like, that's me. That's me. That one's me. Oh yeah. Maybe not Superwoman, but Superman. And then, the great mind. But I think, if I can kind of bring it into sharing, I think the soloist is probably the closest to myself because, I do everything in my own practice, and it can be one of those daunting tasks too, where you're trying to juggle everything, scheduling, taking care of the patients, doing the homework, prep for them, billing if that comes up, and always being a text or a call away can definitely be taxing on the system. So getting away, like I did the last couple of days, and reset the batteries, come back with an energy that way you can do it all over again. So that's really interesting, and it's almost like it could be renamed the perfectionist syndrome. You know what I mean? Yeah,
and I know that for me, that near genius thing or natural genius thing, that kind of always was me. I didn't really have to study much in school. And I think that I probably internalized very few of the successes because I was like, well, it was just too easy, and, with us having to diagnose people. And I think this is where this kind of really hit home for me when I was reading about this originally. At any given time, we're expected to come up with a diagnosis for a patient. And then we're going to sit there and second guess, well, what if I didn't read about the thing that this person has well enough? And I thought it was this, but what if they don't get better? And maybe I'm just getting lucky. Maybe all these people are just getting better through sheer luck. And I mean, let's be honest. I've been doing this for 16 years, man. I have treated people at the absolute highest level of the athletic world and at the tops of their games. But yet still, I'm going to sit here sometimes and doubt my own ability. And I think it really hit home for me when I read about this. And I was like, wow, I have to learn how to beat this. So I found myself finding different audiobooks, and there's a book out there called The Imposter Cure. And that's where I've gotten some of the information on it too. It's very scary, I think, to realize how many people are probably going through this in their mind. So I did put a little shout out on Facebook to say, hey, if you've been dealing with this, let me know. Let me know how you dealt with it, how you overcame it. And one of the gentlemen who responded to me amongst a few was a guy named John. I'm not going to give his last name here, but he's an artist, and he graduated with a fine arts degree. He's just like this ridiculously talented artist. I mean, some of the stuff he puts out, character sketches of the kids from Stranger Things, and just, I mean, it's just, they're cool. Phenomenal, and they're perfectly real to life. And he does it all with Adobe, and really high level artist. I mean, this is not somebody who's just like sketching in their back room. He's phenomenal at what he does, and that's his job. And he said that social media really tweaked him.
Oh yeah.
And he said that,
not in a good way, right?
No, not in a good way, a very bad way. And in fact, he was always concerned that, do I even want to share this stuff that I've done, that I've put all my hard work in? Because what if somebody's going to judge me? What if I'm not as good as this next person? And I think social media these days really lends us to want to always compare ourselves to whatever somebody else is doing. And that's not just in the creative world. That's like, do I want to put up a picture of my house? Well, what if some other chiropractor has a bigger house? Or what if some other chiropractor has a nicer car? I don't want to put a picture of my car. I mean, there's all these weird things that start to happen when you don't internalize your own success and take and take it for a ride and own it. It's hard. So
it's almost, you have to find a way to quiet the mind, because I know there's people who they have, we'll go to like Instagram, for example, they put a post up and they're not getting as many likes as maybe they did in a previous post. And it starts to eat at them. Like, well, what's wrong? Did somebody not like me now or something like that? It kind of rides that same, I know it's silly, but you see all these kids, like you and I didn't have Instagram and Facebook growing up. This is all just within the last maybe 5 to 10 years, and it's one of those things where I think you're going to see kids becoming, adolescents, adults. You might start seeing, maybe like they show here, like there's an increase in something like this. The debilitating could be causing stress, anxiety, low self-confidence, shame, and in some cases, even depression. How crazy is that now, that just because of something like this, where you're trying to almost play like mental chess or checkers to figure out like, well, wait a minute, why don't you just stay in your own lane, quiet your mind, and just be proud of what you did? And I'm just going to read this real quote. I don't like to read things a whole lot. Yeah, right. I love doing that. At the end of the day, remember this: you're here for a reason. In this job, your business, your life, you are worthy. You are better than you think you are. You are smarter than you think you are. You know more than you give yourself credit for. Remember that and remind yourself as often as you need to. I think that's pretty cool. I think if something, you just need to put that on the back of your phone if you're going through a little struggle like this. Find a way to fix it. If not, it's going to eat at you and you're going to miss life. It's going to just run right past you.
And another tip, aside from, of course, stopping your comparisons to people, because let's be honest, on social media, everybody lies anyways. Half the people that say they have all this stuff and they don't even have it for real. It's like they're renting a car to take some pictures with or whatever. So, first off, stop the comparisons. Make a list of the things you have accomplished. Look at that and realize that those aren't by accident. And realizing you're not alone, that other people are going through this. And then externalizing the voices in your head, I think, was a cool one. This was the one we talked about before we went on the air. Taking what you're saying about yourself and pull it outside and say, well, what if somebody that I knew was saying this type of stuff about my spouse, about my brother, about my sister, about my child? There's no way you would let them talk about your significant other the way you talk about yourself. And if your significant other had all the same accomplishments that you have, you wouldn't downplay those. You would be like, wow, look how amazing my spouse is. So take those and try to externalize that voice. And then the other one that was kind of cool was, imagine that if you were hiring a personal trainer in the gym. We always talk about gym stuff, so this is kind of cool. You would never, ever keep that trainer who was sitting there screaming at you, you're a failure. You don't even belong here. What are you wasting your time for? You'd fire that dude. So fire that voice inside of your head and go hire the one that's talking to you about your successes and giving you the high fives and, encouraging you along the way and saying, hey, you got this. Fire that other dude and hire the guy who's giving you the positive reinforcement, because that's really going to make a huge difference. So, hey, listen, this is something that's an ongoing thing for me. I'm still learning, but I thought that it was a really important thing for us to talk about now, just because it's out there. And I think the faster we all grow in awareness that many people, even the best of people, champions in their sport, champions in their field, CEOs, it doesn't matter what position you're in. these people are all going through it, and they're all sitting there wondering with the same type of self-doubt. So if we can quiet those voices and inside there and realize, look, we deserve where we're at, and start to take some self-worth, I think that's a positive thing.
Well said. I love that. Great topic.
So we're going to take a real quick break here, and then we're going to come back. We're going to talk a little bit about our Ask the Doc question.